Tyler Herro suffered an ankle injury recently where he essentially stepped on another player's foot and his foot actually went into a position known as inversion. Currently, sources are saying that he's dealing with an ankle sprain and that he should miss about 2 weeks. Now, anytime a person is going to suffer one of these inversion ankle sprains or a rolled ankle, it's going to stress all of the structures on the lateral portion of the ankle, and I want to focus on the relevant anatomy with today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy as well as what that person should expect when they go to rehab. If you enjoy this sort of content, please hit that thumbs up and subscribe to the channel because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have any experience with a rolled ankle, go ahead and please comment in the comment section below. Now we can see here on the video that as he jumps up, he's going to come down and that right foot is going to land awkwardly on another player's foot, and that foot is going to go into that inversion position. So here I have a model of the foot and ankle, and so the ankle joint is formed by two long bones coming down to form either side of it. The first one being that shin bone is going to be located right in through here. That's going to come down and form that medial malleolus. And then on the outside or lateral portion, we have our fibula bone, which is going to come down and form that lateral malleolus. And then as we look deep inside the model here, this is our talus bone. And these structures together make up what we know as the ankle joint. There are four main motions at the foot and ankle. The first one being dorsiflexion, where the foot is going to bend upwards like this. The opposite of that is plantar flexion, where the foot is going to be coming down like this. Then as we flip the model in through here, this is inversion, where the foot is going to be coming inside like that. And finally, the opposite of that is going to be eversion, where the foot is going to be coming outwards. Anytime a person's ankle is going to go beyond their norm value, they are at risk of injuring it. So in this position, once again, and in this video, we see that as Herro comes down, his foot goes well beyond his normal range of motion of inversion. And when he does this, he's actually stressing all of those structures located laterally. And there are three ligaments that contribute to overall ankle stability. The first ligament is known as the anterior talofibular ligament. So anterior meaning that it is on the front portion of the ankle here. Talofibular meaning it's going to attach the talus and fibula together. Then as we move slightly towards the back here, we have the calcaneofibular ligament. Calcaneofibular meaning that it's going to attach the calcaneus and the fibula like so right here. Then as we go towards the back portion of the ankle, we have the posterior talofibular ligament. Posterior meaning it's located towards the back portion of the ankle. Once again, talofibular because it's going to attach the talus and the fibula together. Now, we don't know which ligament is implicated in this injury, but more often than not, the one that most commonly gets affected in these inversion ankle sprains is the anterior talofibular ligament, or the ATFL for short. However, it's important to know that anytime a person goes into an inversion ankle sprain position, that ligament as well as one or several of the others can be implicated. There is an in-the-clinic test we can do to test to see if somebody is dealing with a lateral ankle sprain, and this is known as the Taylor tilt test. So what we're going to do here is we're going to take the person's foot and ankle. What we're going to do is put them in that inversion position. So we're going to invert the foot just like so. And as we do this, if this starts to reproduce the person's pain and they can pinpoint it, then that makes us think that they're dealing with a lateral ankle sprain. And depending on the location of their pain, we can differentiate a little bit which ligament is being affected. But of course, the gold standard to know for sure is the MRI, and that takes us into our grading system. So there are grades 1, 2, and 3 for these lateral ankle sprains. In a grade 1 lateral ankle sprain, this is where the affected ligament is getting stretched. In a grade 2, this is where you're getting some partial tearing. And finally, in a grade 3, this is where you're getting a full rupture of the affected ligament. In a grade 1, this can take anywhere of about 3 weeks for that sprain to heal. In a grade 2, this is where we see about 4 to 6 weeks. And finally, in a grade 3, because you're getting full rupture of the affected ligament, a lot of times the ankle is going to give out. There's going to be a lot of ankle instability, so there is a substantially longer time there. Sometimes even surgery is indicated. Based on the time that he's projected to miss, it looks like he's dealing with a grade 1 ankle sprain. Anytime we get a grade 1 ankle sprain in the clinic, what we want to do immediately is get as much of that swelling and inflammation out as possible. And we do this through that acronym RICE. We rest, we ice, we do some compression, and finally we do some elevation. Then once it starts to calm down a little bit, we allow the person to work on range of motion because we want to make sure that they get back to their norm value of range of motion at that ankle. And after that, we can start to work on strengthening and then sport-specific movements. So essentially, we're going to need to wait and see how he does with his follow-up visits and any information regarding physical therapy. If I happen to hear anything, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So fortunately for Tyler Herro, it looks like he dodged a bullet here and has more of a lower grade ankle sprain. We wish him the best of luck moving forward with his recovery. Thanks again for tuning into my channel. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the other videos that I've talked about. Thank you once again for tuning in, and I'll see you next time.